It's a privilege to speak with you today as we come together to recognize Mental Health Awareness Month, observed every May. This month is not just a calendar event, it's a movement. A movement of hope, of healing, of advocacy. A time when we pause to acknowledge the profound impact of mental health on individuals, families, communities, and societies as a whole. Since its inception in 1949 by Mental Health America, Mental Health Awareness Month has grown into a nationwide and increasingly global campaign. For 76 years, it has helped bring mental health out of the shadows, promoting understanding and support, while urging action on the systemic, social, and personal levels. Why this month matters? The 2025 theme is Turn Awareness into Action, and it couldn't be more timely or necessary. In recent years, we've made great strides in recognizing mental health as an essential component of overall health. We've seen public figures speak openly about anxiety, depression, PTSD, bipolar disorder, and more. Schools and workplaces are beginning to integrate mental wellness practices. Governments are starting to increase funding for behavioral health. But awareness alone is not enough. We are being called, all of us, to do more than listen, post, or sympathize. We are being called to act. Understanding mental health, the scope and the stakes. Let's begin by understanding the scope. According to the World Health Organization, WHO, 1. Depression is the leading cause of disability worldwide, affecting over 280 million people globally. To 1 in 5 adults in the US, that's over 50 million people, experience a mental illness each year, according to the National Institute of Mental Health. 3. Over 11% of youth in the US experience major depression, and rates have been steadily increasing. 4. Suicide remains a leading cause of death among young people, with 1 death by suicide every 40 seconds globally. Yet despite the scale, nearly half of those experiencing mental health conditions do not receive treatment. Barriers like stigma, lack of access to care, cultural misunderstandings, and economic hardship continue to silence millions of voices. The importance of mental health awareness. So why do we support Mental Health Awareness Month? Why do we speak, educate, and advocate? Because 1. Awareness reduces stigma. It dismantles the myths and misconceptions that mental illness is a personal failure or weakness. 2. Early intervention saves lives. Studies show that early detection and treatment can dramatically improve outcomes, especially for children and adolescents. 3. Open conversations normalize struggle. Mental health challenges affect people across every demographic, and when we talk about them, we foster empathy, not judgment. 4. Education empowers communities. Knowledge helps people recognize warning signs, understand treatment options, and support loved ones in crisis. The role of organizations and global solidarity. While Mental Health America pioneered this observance, they are not alone. The World Health Organization, National Alliance on Mental Illness, NAMI, Sanhasa, and countless non-profits around the world amplify this message. Special observances within May, such as National Children's Mental Health Awareness Day, highlight vulnerable populations, emphasizing that mental health care must begin early, be tailored, and be equitable. In 2025, Mental Health Awareness Month emphasizes global solidarity. The goal is not only to raise awareness, but to create an empathetic, unifying voice that empowers individuals to take action and inspires hope for those who are struggling. Whether in a small rural town or a bustling city center, everyone deserves to feel seen, heard, and supported. Turning awareness into action. So how do we do that? 1. On an individual level, we can start by being open, by checking in with ourselves, with friends, with coworkers. We can educate ourselves about different conditions. We can reduce the use of stigmatizing language and instead listen with compassion. 2. In schools, we can push for mental health curriculum, training for teachers and counselors, and accessible school psychologists. 3. In workplaces, we can advocate for wellness programs, mental health days, and inclusive policies that value psychological safety. 4. In policy, we can support legislation that expands mental health coverage, increases funding for research, and provides community-based resources. 5. In communities, we can create safe spaces, support groups, wellness centers, peer-led initiatives that empower individuals to seek help without fear of discrimination. The power of hope. Mental Health Awareness Month is not just about identifying what's broken. It's about believing in and working toward what's possible. It's about recognizing that mental illness is treatable, that recovery is real, and that hope is a form of resistance. Each time you speak up, reach out, or advocate, you're not just raising awareness. You're changing the culture. You're creating a world where it's okay to not be okay, and where getting help is a sign of strength, not shame. Let this month not be the end, but the beginning of deeper conversations, of stronger community, of lasting transformation. Together, let's turn awareness into action. Because mental health matters. Because people matter. Because you matter. Thank you.